All right, let's dive in. Today, we're talking about something almost all of us think about at some point, blood pressure. And we've got some fresh insights to share because we're going to be breaking down the brand new 2024 guidelines from the European Society of Cardiology. Basically, we're going to see what the absolute latest science tells us about how to manage it the right way.
So let's just jump right in with a super common scenario. You're at the doctor's office, they take your blood pressure, and the number is high. What does that actually mean? Does that one reading automatically mean you have hypertension? Well, as you're about to see, the real answer is a bit more complicated than a simple yes or no.
And that's exactly where these new 2024 guidelines are such a game changer. They give us a much clearer, much more modern way of looking at the whole thing, from how we measure it to how we diagnose it, and of course, how we manage it. So let's get into what they recommend.
Okay, section 1. Let's talk about the numbers themselves. I mean, it all starts there, right? But what's really crucial here isn't just knowing your numbers, it's making sure you've got the right ones. Because, every decision kind of flows from that.
And this is a really big one to get right out of the way. That one high reading you might get at the doctor's office, it does not automatically mean you have hypertension. Think about it. It's just a single snapshot in time. Your blood pressure goes up and down all day long. So the new guidelines are super clear on this. One reading is just not enough to make the call.
Okay, so if a single reading isn't the answer, how do we get a real, accurate picture of what's going on? Well, that brings us to our next section, all about the measurement process, which you'll see is a huge focus of these new guidelines.
The magic word here is repeated. Yep, the diagnosis really hangs on getting multiple measurements over time. And, even more importantly, the guidelines are now strongly pushing for these readings to be taken outside the clinic. Why? Well, to get around that classic white coat hypertension, where your blood pressure shoots up just because you're a little stressed at the doctor's office. And this right here really shows you how much the thinking has changed. The whole idea is to see what your blood pressure is like in your real everyday life, not just in a sterile clinic for 5 minutes. Checking it at home gives your doctor a way more realistic and, honestly, a much more reliable picture of your health.
So, what are our options? Well, there are basically 3 main ways to get these numbers. You've got the standard office BP. That's just a quick snapshot during your visit. Then there's home BP monitoring, or HBPM, where you take the readings yourself on a regular basis. And finally, there's ambulatory BP monitoring, ABPM. That's where you wear a device for 24 hours that automatically takes readings. And what's key is that the new guidelines really put the spotlight on home and ambulatory monitoring for getting that confirmation.
All right, section 3. We've talked about how to collect the numbers accurately. Now for the big moment. How does a doctor take all that information, connect the dots, and actually make the call on a diagnosis?
So here it is, the official line in the sand. Hypertension is defined as a confirmed office reading where that top number, the systolic, is 140 or higher, or the bottom number, the diastolic, is 90 or higher. And I'm going to keep saying it, that word confirmed is doing a whole lot of heavy lifting here.
Now check this out, because this is where it gets really interesting. The thresholds, the numbers that define each category, are actually different depending on where you take the measurement. Take a look at the hypertension row. In the office, it's 140 over 90, but at home, it's lower, 135 over 85. And that's because those out-of-office readings are considered more representative of your true blood pressure. So if you put it all together, the whole process makes a ton of sense. Step 1 is that initial screening at the doctor's office. If those numbers are looking a bit high, step 2 is to confirm it with measurements taken at home, either with a home monitor or an ambulatory one. And then, step 3, the official diagnosis isn't based on one reading, but on the average of all those repeated, accurate readings. Simple as that. And, once that diagnosis is confirmed, it's really not the end of the story. It's the beginning of a new chapter. The guidelines really stress that this moment is all about communication. It's the point where you and your doctor sit down and start building a plan together as a team. Which, of course, leads us right into our next section, creating that treatment plan. So, once you have a diagnosis, what happens next? What are the tools in the toolkit for managing high blood pressure?
The whole approach really boils down to 2 main strategies, 2 main pillars. On one side, you have lifestyle interventions. This is the bedrock, the foundation. It's recommended for absolutely everyone with elevated blood pressure or hypertension. Then on the other side, you have medication, what we call pharmacological treatment, and that's prescribed based on your specific numbers and your overall risk for cardiovascular issues.
So when we say lifestyle changes, what are we actually talking about? It's not vague advice. The recommendations are super specific. For sodium, the goal is to get down to about 2 grams a day. That's roughly 1 teaspoon of salt for everything you eat and drink. And for exercise, they recommend at least 150 minutes a week of moderate aerobic stuff. Think brisk walking or cycling. And then backing that up with some resistance training 2 or 3 times a week.
Now, for when those lifestyle changes aren't quite enough to get you to your goal, medication is an incredibly powerful tool. And it's important to think of it not just as a way to lower a number, but as a proactive way to protect your long-term health, your heart, your brain, your kidneys.
So, when does the conversation about medication actually start? The guidelines are pretty clear here, too. If your confirmed blood pressure is 140/90 or higher, the recommendation is to start both lifestyle changes and medication right away, together. But if your pressure is in that elevated zone, the first step is usually to focus hard on lifestyle changes for about 3 months. Then, if your numbers are still high or if your overall risk is high, that's when you'd add medication into the mix.
And that brings us to our final section, which is maybe one of the most important updates. Once treatment starts, what are we actually aiming for? What's the target? It's not just lower is better anymore. Now it's all about hitting a very specific, optimal target zone.
And here it is. This is the range to remember. The new target for that top number for your systolic pressure is somewhere in the 120s.
Yeah, this is really the new sweet spot for most adults. The goal is to get that systolic blood pressure down into that 120 to 129 range. But, and this is a really important but, that's only if the treatment is well tolerated. It's no good hitting the number if the medication is making you feel dizzy or unwell.
And this quote directly from the guidelines really sums up the whole personalized approach perfectly. It's something called the ALARA principle, which stands for as low as reasonably achievable. What does that mean? It means the goal isn't a rigid one-size-fits-all number. It's about finding the lowest blood pressure you can comfortably and safely maintain to get the absolute best long-term health benefits. It's tailored to you. So we'll leave you with this final question to think about. When you look at all these new guidelines, the biggest takeaway is that managing blood pressure isn't just about taking a pill or a one-time fix. It's about creating a sustainable, long-term partnership with your doctor, a plan that's built on good data, shared goals, and that truly fits into your life for the long haul.